John is a 50-year-old lawyer. Due to his high workload, he is under a lot of stress and has no time for exercise. He is a heavy smoker and has a high salt diet. One day, he presented with blurred vision and a severe headache, so he went to the doctors. His blood pressure was 146 over 106 millimeters of mercury, and the rest of his physical exam was unremarkable. A 12-lead electrocardiogram reading showed no abnormalities, a serum electrolyte test was normal, and his BMI was 32. Primary hypertension. Hypertension is a constant elevation of the systematic arterial blood pressure, with the systolic pressure greater than 140 millimeters of mercury and the diastolic pressure greater than 90 millimeters of mercury. Primary hypertension is a type of hypertension that doesn't have an identifiable known secondary cause responsible for the high blood pressure. However, there are many risk factors associated with this disease, such as high salt intake, high cholesterol, alcohol, obesity, lack of exercise, smoking, stress, and family history of hypertension. What is blood pressure? Blood pressure is the pressure exerted by the heart to pump blood from the ventricles to the systemic circulation. The formula for blood pressure is cardiac output multiplied by resistance. Since cardiac output is the stroke volume multiplied by heart rate, anything that increases stroke volume, heart rate, or resistance will increase blood pressure. Hypertension is highly associated with sympathetic stimulation. When the sympathetic nervous system is activated, norepinephrine is released to bind to the beta-1 adrenergic receptors in the heart, causing the pacemaker to fire more rapidly, causing an increase in heart rate. Increase in sympathetic stimulation increases contractility. Norepinephrine binding to the beta-1 adrenal receptors increases intracellular calcium. This in turn promotes more cross-bridge formation and enhanced ventricular contractility. The increase in contractility lowers end-systolic volume, leading to an increase in stroke volume, therefore increasing in blood pressure. Long-term mechanisms of blood pressure is via the kidneys through the renin-angiotensin-aldosterone system. The liver produces angiotensinogen and is continuously released into the blood. The granular cells of the juxtaglomerular complex of the kidneys release the enzyme renin into the blood in response to stimulation of the sympathetic division. Within the blood, renin converts angiotensinogen into angiotensin 1. Angiotensin 1 is then converted to angiotensin 2 by the angiotensin converting enzyme, which is found in the lungs and kidneys. Firstly, angiotensin 2 acts as a potent vasoconstrictor, directly increasing peripheral resistance and raising blood pressure. Angiotensin stimulates the posterior pituitary to release antidiuretic hormone, or ADH. ADH increases the absorption of water in the kidneys, which increase blood volume, resulting in an increase in blood pressure. Angiotensin 2 also stimulates the adrenal cortex to release aldosterone. Aldosterone increases the reabsorption of sodium ions in the kidneys, and as sodium ions is reabsorbed, water follows. This consequently increases blood pressure. Overall, due to high blood pressure created by many factors in the body, it can cause symptoms such as headaches. This immense pressure is also present in the brain, disrupting the function of the blood-brain barrier. Normally, it will regulate the amount of fluid entering the cranial cavity, maintaining a homeostatic environment. However, in hypertensive patients, the blood pressure would overwhelm the blood-brain barrier, causing hyperperfusion to occur, increasing the cerebral spinal fluid. This increase in fluid creates edema inside and around the brain, producing intracranial pressure, which is extremely dangerous since the brain is in such confined space within the skull. This is potentially bad because it results in buildup in fluid around the brain, therefore pushes against it and creates shrinkage of one side, impairing blood supply and causing further side effects. Another complication that hypertension can cause is blurred vision. This is due to many disturbances, mainly in the vascular portion, in providing blood to the eye, specifically hypertensive retinopathy. In hypertensive retinopathy, the immense force of the blood breaks down the inner blood-retinal barrier, which consists of damage to the arterioles of the retina, and cause atrophy or thickening of the arterial walls. This damage results in swelling, which impairs blood flow, leading to hemorrhaging and the development of cotton wool spots, which is damage to the retinal nerve fibers. Other symptoms of hypertension include chest pain, heart failure, vomiting, vascular damage, osteoporosis, and kidney failure. An example of antihypertensive medication is ACE inhibitors. ACE inhibitors inhibit angiotensin-converting enzyme, which decrease angiotensin and aldosterone release. Also, we can reduce a patient's blood pressure by changing their lifestyle through frequent exercise and low salt and low fat diets. Antihypertensive medication and lifestyle changes can help manage blood pressure for hypertensive patients. Thank you.